levels probably is diabetes, classic chronic disease. Statistics Canada says that over 20% of seniors in Kingston alone are considered to have diabetes. And in mainstream medicine, generally, you go for your screening tests, you have your blood work done, you do a fasting blood sugar, and usually that's it. Sometimes you get a little bit more if you've got a family history, a marker of about a 3-month understanding of how high your blood sugar's been. And when you go over a certain mark, now you're pre-diabetic or you're diabetic. And fortunately now we've got family health teams and you're referred maybe to a dietitian who can give you a diet for diabetes, which includes dairy and a lot of other kind of carbs, which is controversial for helping the body heal a diabetic state. Part of this idea of prevention in integrative medicine is, well, developing that chronic disease state took years and years to develop. We are looking in mainstream medicine for objective evidence when your blood sugar stayed high, remained high. But how hard has the body been working for the last 10 years, say, to keep it in that narrow range? And you can measure on blood work, if somebody wants to, the hormone insulin, for example, which is the hormone that your body releases to help keep that blood sugar in a steady place. And you can see, is it through the roof trying to keep your blood sugar in a stable level? Or is it tanked? You have almost none left. That's a different kind of diabetes. Can we measure this years before your blood sugar really goes off? And can we do something to help your body balance insulin levels or respond to insulin levels so that your blood sugar is a little bit more stable? I don't know if this is a little bit too much information, but with diabetes, insulin is a hormone that builds up. They call it an anabolic hormone. It's when your body's in a state that it can take energy and grow, it can make muscle, it can do good things, it's building up. And when we are in a stressed out state, you are breaking down, you are getting away from the danger. Our bodies are created evolutionarily to get out of an acute stressful state, get away from that tiger, get away from whatever that animal is that's going to eat you, and then you're good to go. Our bodies are created to withstand acute stresses constantly, but acute stresses with big breaks in between. And the consequences of that shift to a different kind of metabolism in that acute stressful state mean we get a lot of energy really fast, but we get a lot of junk made up at the same time, and we use a lot of resources to get that energy really quickly. We break down. And bodies these days, we are in a chronic, low-grade stressed out place. We are in that acute stress physiological mode chronically. So we are getting energy quickly and using it really inefficiently and making a lot of toxic junk in our bodies that we're not made to handle, and we get tired. And how can we expect the body to make a hormone like insulin, which builds things up, when we are constantly on guard and on edge and expected to do way more than what our bodies are, what we're supposed to do in our jobs, in our home life, and in that balance that's so elusive for all of us. Does that make sense? Mm-hmm. Yeah? So let's look at that stuff for real prevention in medicine and prevent the illness from happening. The other idea here, organ reserve for disease prevention. Let's just improve how organs function. Just do that so it can withstand a stress much more easily. And then finally, two main concepts in mainstream medicine for prevention: screening tests for prevention of disease. And when Health Canada says something like mammograms are for prevention or an important preventative practice, they mean have a mammogram to prevent death. They don't mean have a mammogram to prevent breast cancer. A lot of people don't think about that. And if 1 in 9 women end up with breast cancer, and a lot of people don't know either that breast cancer tends to be most deadly for women in their 30s and 40s, not postmenopausally, even though it's most common in women who are older. It takes some serious consideration, mammograms, and what do they mean? And this month in BMJ, some Canadian researchers released a report that said that mammograms did nothing for women in their 40s and 50s. Did you see that?
Yeah, I heard it on the radio.
I said it 20 years
They
ago.
come back to this.
They did nothing for death.
Yeah.
And this keeps coming up. Cochrane Review a few years ago did the same thing. And It's very possible that, I wrote down, when the Cochrane Review is considered a research group that doesn't have the biases associated with a lot of other research groups. And their stats included, for every 2,000 women tested with a mammogram or screened with a mammogram, you might save one life, which is a good thing. But you'll get 200 women with false positives and 10 women who are misdiagnosed with breast cancer and undergo treatment, which means a mastectomy or radiation. And again, it's all statistics, and there are many good research studies to say that mammograms do save lives. But it's very controversial. It's not as clean cut as we'd like to think. And when screening has become a public health issue and there's so much pressure to go through it, instead of informed choice, we're not given adequate information to make good choices for ourselves and what our belief system includes or doesn't include. So we can say, yes, I'll have that mammogram screening the moment I hit 50 or 52 or whatever it is, or not, because I'd rather not go through those processes. And the one disadvantage of these negative studies for mammograms include the way our system is set up. What if policymakers take these results seriously finally and now withdraw our capacity to access mammograms for those of us who would like them? Well, that's a real possibility too. So it's just about becoming informed, and that's where a lot of integrative medicine excels, is in working with somebody, understanding where they're coming from, what it is they need, and educating, providing resources, knowing the ins and outs of really what the research says or what other medicines suggest. And then finally there's just vaccines. That has to do with symptom management versus treating the underlying cause. Do you kill the bug and is that all there is to it, or do you address the terrain or the immune system function, for example? The consequences of relying on vaccines to save lives instead of supporting optimal immune function so the body can take care of it. And even the idea that you need some amount of good immune function to respond to the benefit of the vaccine. If your immune system doesn't work well, the vaccine is not going to do very much for you, which is partly why even though seniors are most likely to get the vaccine with the public pressure that we have, they're also most likely to not respond to the vaccine and have complications from a bug. And that doesn't even get into the politics of whether the vaccines actually are effective or not, whether they pick the appropriate viral strain of the year or not. And the other research that comes out that says, vitamin D, for a lot of people, if their status is good, works better than the flu vaccine. There's some interesting research about that. There's some interesting research about if people who had the flu shot, were they more susceptible to H1N1? Probably, but we don't know yet. That research doesn't get a lot of funding, I don't think, sometimes. So that's some of the underlying differences of integrative medicine versus mainstream medicine. And now it's about really spending some time understanding, what does your genuine self need authentically, what feels right to you, what kind of medicines are you looking for, what kind of guidance would you like or do you need, and on your own healthcare team, if one in Canada, the public healthcare system, does believe that they have the right to develop their own healthcare team for feeling well, does it include environmental consultants, for example? Go through your house and get rid of the molds and the off-gassing things. Address whether you go to the golf course all the time and if those pesticides do a lot, or herbicides do a lot to you. Look at your healthcare providers. Do they include just the mainstream healthcare providers, which is perfect for some people, or not at all, or a combination, and in what form? Spiritual leaders, the mental emotional piece, family, friends, social support network. We know loneliness is one of the biggest killers for women. A lot of studies about that, but in a total different area of science, and you don't sometimes see these different areas of science meshing very well. So that's it. Any questions or talking about your own philosophy?
That point that Diane said at the beginning, it's the same idea as what we said at Wanapate at the lecture and film there. A healthcare system, it's not designed to keep us healthy, it's